A very warm welcome to all of you, wherever you might be tuning in from. Welcome to KDRTV Live. Today is Sunday. It's is about 10:20 here in the state of Minnesota. And it's 11:15 or so in the East Coast, and it should be 6 East African Standard Time. So happy to have you on today. We're going to have an interesting discussion today, beginning with a conversation with some of the candidates here who are running for elective offices and from within the African immigrant communities here in the state of Minnesota. We'll begin our conversation first with Boni Njenga, who's also running for the position of commissioner for Hennepin County here in the state of Minnesota. And then shortly after that, we'll be talking to Sahra, who's also running to be one of the state senators here in the state of Minnesota. Shortly after that, we will be welcoming our brother Nasibu Serefa from the African Development Center, who will be talking about the power of numbers. I really encourage you guys to make sure that you tune in also during that time. So for now, I want to bring on the show Boni Njenga. Hey, Boni, how are you, sir?
Thank you so much. Thanks so much for having me. Good morning.
Good morning. Let me begin by saying that you look absolutely fabulous.
Thank you so much, mate. On Sunday morning, you have to look sharp.
Yes, and I have to admit that your tie is much better than mine.
Well, thanks to Macy's, I guess.
Thanks to Macy's. I'm sure Target and Walmart would be curious about that. So, hey, it's good to have you on. Obviously, as we did promise our viewers today, we'll be talking about what the African immigrants are doing in the U.S., particularly those ones who are running for political offices, and obviously beginning with you today. So, but just very quickly, for the sake of our viewers to get to know who you are, do you mind introducing yourself very quickly for our viewers?
Absolutely, yes. Yeah. Thank you so much for having me once again. My name is Boni Njenga, a Kenyan immigrant. I came to the U.S. 17 years ago. And, when I said 17 years ago, it's just like life just goes very quickly. I didn't expect that to be 17 years now. But I've been, the last 17 years, I did go to school here. So all my 20s and my 30s have been the U.S. Half of my life has been the U.S. I went to school in a public schools, one of the best public schools in Minnesota called Minnesota State University in Mankato. And since then, I've been working close in the community, and I decided, hey, let me take a shot in this public service.
Okay, fantastic. So it's good, excellent intro, but they're so proud of you, the fact that you're really even deciding to go public, which a lot of us really don't want to do, but obviously send you a word of congratulations and tell you that not just me, but KDRTV, all our entire crew here and many others obviously appreciate what you're doing. So I want to make sure that you're safe with us and you will be a friend all the way. So let's talk about what is obvious today and affecting everybody around the world. I mean, that's COVID-19. It's affected people. I think most people thought it was a virus, and it's getting even serious, and including now the President of the United States sitting laying in a hospital because of this pandemic. How are you personally and professionally dealing with this?
Well, the first couple of months for everybody, January and March and April, and all of us, it was a new thing. It was a new pandemic that none of us knew what to do. We were all anxious, wiping the doorknobs, wiping everything, and. For me personally, the first couple weeks, it did hurt me professionally because I got followed, and majority of Americans who end up losing jobs. I think right now we have more than 50 million Americans who have applied for unemployment benefits, in the country, and it shows you that everybody's being affected, and none of us even know how to move forward. We don't know how long it's going to take. And I'm at a better position. That have been working for the last couple of years. But if you look at the state of Minnesota, we have so many people who have been affected, have been evicted. And I believe right now the AG has more than 1,500 cases right now of eviction in his office, and this shows you that how much everybody is losing. And when we talk about let's say like how the schools have been affected. Right now, we're talking about some schools that some kids, some parents don't have 2 laptops, or probably even 1 laptop, and right now we need to do the distance learning, and the same parent has to go to work, and now they have to manage going to work and trying to help their kids and so forth. So it's affecting everyone in different capacity.
Okay, good to hear. Thank you, Boni. So here's the interesting thing. By the way, I read a very interesting article in the East African Standard about you.
Right.
Who wrote that article was very brilliantly written, and they told a very good story of a young, not very nice boy in Nakuru, growing up but being brought up by an absolutely wonderful mom, thanks to that mom, and obviously with elder brothers who did everything possible to get that boy to the United States. And luckily enough, he's the good-looking guy that I'm talking to today. So let's talk about leadership. So for the sake of our viewers, what did you learn from your parents, especially your mom, in respect to leadership, and how does that lesson really inform your leadership understanding?
When I was growing up, I used to. My mom, she's a people's person, and she used to take me to go to the market, to the circle, and I used to. I used to be like, why are you taking me? And she'll go home. How African mothers are like introducing their sons to every single person that they meet. And later on, actually, right now as I'm campaigning, that's what I'm using, because one I realized that my mom taught me how to listen to people and how to have that not judging, saying hi to everybody. And giving them time, giving them every candidate you're talking to, everybody you're talking to, your time and giving them one-on-one. So I wanna thank so much my mom for giving me that a good foundation. I was raised by a single mother, and going back to that article, it was very candid, and this shows you that one thing I tell people that my mom really believed in America so much. My mom believed the land of the free, land of the brave, because I went to 4 high schools in Kenya. So after my final years, you have the gap year before you go to college, and so mom was like, no, and at that time, I don't know if you remember this, but we had this the kumi pombe, Yes. And mom was like, no. I think if you stay here, you're gonna be very bad, So she's like, no. I'm gonna ship you to America. And I tell people that me, I got the visa the same day, came to the US the same day. that's how my mom was going to send me to America. But right now, I'm one of our proudest. I'm one of her favorite kids, for what I've achieved in America, yes.
Yes, I think you chose the words very carefully so that you don't get in trouble with your siblings, but I'll tell you for sure that, you are great. So knowing what you now know then, and talking to our viewers who are looking at you as a potential commissioner in the state of Minnesota, and obviously not just in the state of Minnesota, but there are many young people across the country who are watching you and thinking, wow, this is so inspirational. We're probably having another Ilhan Omar, or we're having another Obama in the making. What are your 3 strengths that you think can propel you into the position of leadership?
I would say Minnesota gave me one of the best education. I appreciate state of Minnesota, and when I say I'm a proud Minnesotan, I'm a proud Minnesotan because I have achieved a lot in Minnesota. When it comes to education, I have a bachelor's in political science, and I have a master's in public administration, and I'm one of the best when it comes to policy. And this is what you see of all the candidates. I'm the only one. I can say this categorically, confidently, that I'm able to bring new ideas on the table. And this is why I'm saying that we need to introduce evidence-based policy making. So I'm not running just to run. I'm running because I'm able to show that that I have data and have research to back what I'm saying. Especially when it comes to Hennepin County. So that's something that I feel like I'm very uniquely qualified to be in this position.
Okay, so thank you, great, I appreciate that. So let's focus now, switch focus to specifically Hennepin, and by therefore viewers who are watching might wonder what is Hennepin. Hennepin is the largest county in the state of Minnesota, and I think the largest county that has the most immigrants. And obviously people watching, not necessarily immigrants, every citizen within that county. So the question I might have for you is obviously knowing what you now know. You having been brought up in Kenya, having gone to school here, having met friends from all walks of life. Why specifically are you running for this particular position?
That's a very good question. You know, 10 years ago, around 10, 11 years ago, once I finished my bachelor's degree, I moved to the city, not to the Minneapolis, Hennepin County, and I had a full-time job with the state of Minnesota. A full-time job, I think I was getting paid $70 an hour, something like that. And with school loans and bills and so forth, fresh from college, I was unable to pay my rent, and I was evicted. And that's the point that I came in contact with Hennepin County, because Hennepin County is supposed to be a social net for anybody who's struggling, because it's the county that offers you social services, and that's what I realized later on. Actually, Hennepin County was unable to help me, because apparently I was making a lot of money at that time. So what I did is that I was able to be helped by a nonprofit organization called VIP. It's based right here in Bloomington. And I was like, how come when the county is supposed to be the social net for you, but was unable to aid me? And that made me do research on it. And I realized it's because of efficiencies. And I said, you know what? Hey, if not me, and then who else? Have had the experience of being on the bottom, and I would not want somebody else to be there, to be where I was, because I had a full-time job at that time. And I said, you know what? Hey, no, I need to see what was going on here. And I realized, Hennepin County is very behind when it comes to modernizing governance. And so I was like, you know what? No. This is the best, because I have had experience in the community for the last 10 years. I've actually held forums with the current commissioner. I've co-chaired some of the forums in this district, and I said, you know what? Hey, if not me, who else?
Okay.
Yeah.
So, good. So it's actually you.
There you go.
So the answer is simple. It's actually you, and that's what it is. So let's talk about, you talked about experience, interesting experience in Kenya, experience in schools, and experience working obviously in corporate. But share with our viewers, especially those ones within the Hennepin County. What's your experience when it comes to working with a diverse group of people? You know as best as I know that Hennepin County is very diverse in nature. There are African immigrants, there are African Americans, there are Asians, there are whites. Pretty much every background is in the county of Hennepin. What is your experience working with those diverse groups, and how does that experience prepare you for this position?
My experience, it's very wide. I'm actually in so many groups, but the last couple of years I've been very fortunate to work with one of the close most career here in Bloomington, called Farouk. And what I've been doing for the last couple of years, writing grants for them, and I've been able to meet down with mothers who are struggling, single mothers who need financial literacy, and who need us to represent them in schools. So I've had a wide variety when it comes to working with diversity, especially in Bloomington, the last 10 years.
Okay, very good. Let's switch focus to specifically immigrants, and as you know, KDRTV particularly, our centerpiece for all this is that we're trying to, as much as possible, drive a positive diaspora narrative. That's key. I mean, there's so many challenges, that's understandable, but we cannot necessarily focus on the negatives. We also need to focus on the positives. So more specifically to the immigrant population, what 3 specific issues do you think are affecting the immigrants?
One is affordable housing, because right now, for example, a 1-bedroom in these areas is ranging between $1,200 to $1,500, or sometimes more. So affordable housing. Right now, the current most issue is COVID-19, distance learning, affecting most of immigrants. And I would say the other thing also is creating community wall. What I mean by that is that I've having spoken to immigrants, you find that most of us tend to come with other professionals from, let's say you are you are working as a mechanic in a mechanic or some sort of paraprofessional back home, and then you come here and then you have to start from zero, and then so what can the county do? The county should be able to ask you, hey, what are your skills? Let's say if I was a mechanic back home, how can the county help you to start a small business? And that's one that I feel like the county has failed when it comes to realizing the potential of immigrants, because most of us come here and then we have to do CNA training, and then we waste our 2, 3, 4 years trying to figure out who we are, and we already had professionalism positions or skills before we came to the US.
Okay, good thinking there. So here's a question. Obviously, it's a public office. It's not. It's a public office that you're running for. The key point, once you get to the office, and obviously wishing you the very best, is that you will have to make decisions, and not just decisions. You're going to make very tough decisions. Sometimes decisions you have to differentiate. They're either personal decisions, family decisions, business decisions, political decisions, religious decisions, whatever that is. But if elected, you're going to make decisions. And in part, a huge part of our audience are looking at you as a possible person who's going to be their link and hope. What will inform your decision-making process?
Well, one, obviously, as a human being, definitely you gotta have empathy for sure. For somebody who's struggling. At the same time, and this is where I'm running into with something called evidence-based policy making, because it's a new era of governance that enables our commissioner to use data and research, and this will enable us to make the right decision when it comes to policy making, because research affects policy and policy affects lives. So when you have the best data, the best research, it will save life or will affect somebody's life.
Okay. So I was looking at the immigration overview the other day around counties. I'm not exactly sure, but I know Inoka has around 30,000 foreign-born immigrants, and I think about 18,000 naturalized citizens. Do we have an idea how many immigrants are in the Hennepin County?
A good question. Good question. I have the numbers somewhere, but I want to say it's way more than that.
Okay.
It's way more than that, because Hennepin County has 1.2 million people.
Okay, so that could be very high, and that really puts a lot of weight on you. That's essentially what
right. Exactly, and right now, like right now, when we talk about let's say Lake Street in Minneapolis, it has a lot of immigrant businesses that have been affected right now with COVID-19, and also when it comes to the uprising we had a few months ago, and so the people that we need to first worry about,
Okay, very good. And to our viewers who are watching right now, by the way, we're talking to Boni Njenga, who is running for the position of county commissioner in the Hennepin County here in the state of Minnesota. If you have any questions for him, please post those questions on our comment section on Facebook or YouTube or Twitter. We'll bring those questions here momentarily, or comments if you have any questions. Again, as we talk, just Sahra Odowa is also standing by to come on, and as we're talking about business, Sarafa, I think Nasib Saraba is standing by from Africa Development Center. We'll be talking about businesses within the African community, and I think that might also get the numbers as well. So here's a question. Most people are obviously concerned that, it's a political office. People run for office as soon as you get elected, and hopefully you get elected, you just forget about the people. If elected, how will you make sure that you stay in touch with the immigrant community especially?
One thing that I've seen somebody very in a different county that's doing is that holding forums every be it monthly or so forth in the community, in the community centers, just tell and giving people your calendar in advance. Tell them, hey, you know what? Hey, I'm going to hold from next month in the city of Eden Prairie, Bloomington, or Richfield. Between and also give them choose the right times. You know, most of us have families, have kids. Don't have a forum at 7 in the morning. You know, I've seen so many so many companies here in Minneapolis. They hold breakfast forums at at 7 in the morning, 8 in the morning. Come on, who's gonna make it? You have 2-3 kids to drop from school and so forth and go to work. So at least for let's say for most of our communities, which brings me a lived experience is that I want to have forums on a Saturday afternoon or on a Friday evening. On a Sunday afternoon, a time that accommodates everybody. That have an hour or 2 forums and ask people, hey, this is what I'm thinking, and what are your views on this?
Okay, very good. Again, for our viewers, if you have any comments or questions for Boni, please feel free to post them there. Again, Boni, KDRTV will always be your friend all the way. So let's switch to I'll talk about the big picture here. Some people have described this year's elections as the consequential elections or election of our lifetime. Why, in your view, do you think people should really participate in this year's elections?
Good question. Well, I guess the election applies to more of in terms of federal level. For me, is that if you look at how the COVID-19 has been approached, comparing to other first world countries, Germany, France, or even small countries like Taiwan, who were able to approach it in a very data-oriented and a very scientific manner, and they're able to have a very small number that has died in their communities. So I think what 2019 has taught us is that who has leadership and who has the best interest for the country.
For the country. Okay. By the way, so when I have a few questions from the audience, I don't want to be at the center of this thing. There are a lot of people who are really watching you, and some might think I'm being too nice to you. So I see some questions. And by the way, I honestly have to say that I appreciate you. You seem to be very eloquent and really polished with ideas, and this is exactly what we really want to see going forward. So there is a first comment. I think your quick reaction. Is that a question?
That's the question, yeah. But we have one. We do have another secretary. We have one. Correct me on that, because I think we do have one.
I'm not particularly sure, but Undersecretary for African Affairs, no, I'm not particularly sure that. If our technical guys can bring up more questions,
yes,
I'm not sure we have that.
The State Department has a position, has an Undersecretary who just focuses on African affairs.
No, I think what the question what
they're not a full secretary, but the Undersecretary. So we do have one. But correct me on that.
So I think essentially the question is what the question is, a big picture, they're trying to say we have a huge population of immigrants around here, especially in the Twin Cities. I think the big picture is what do we do to make sure that we bring all the immigrants together so that we can speak same voice or same on the same tone. That's essentially.
Very good question. I know we have to look at other communities what they have done. And I do say that most of our communities, what they do is that most of us come here with student visa, like I came here for student visa. We go to college and then we move to the suburbs, and then we're not actively or engaged in what's going on. And we are raising kids. You don't know who is your mayor, you don't know who is your who's in your school board. You have no interest, because you have a full-time job, you have a good job, you have a well-paying job, you're paying your bills, you have a big house. But at the same time is that these people are affecting your kids every single day, affecting the decision that you're making for your kids, your taxes, your roads, how they're going to be designed, so forth. So it's very important for us as a community to be engaged. But how do you get engaged? By definitely being organized. being organized is the most important thing. And that one last point is that, right now, especially like the Kenyan community, we do have a very young, engaged, and very active president and Madam President holder. So, people who are visionary in that aspect.
Okay, very good. Again, there's a question from, I think a brilliant question from Jacob Mokoro there. I think one of your potential voters. I think if you're able to read it, Hennepin County property taxes are the highest in the state. If elected as a county commissioner, do you plan to promote any changes to existing taxes? If so, why?
Yes, so Makoro, thanks so much, and I want you to go on my website, but then follow me on Facebook, Makoro, because one that I've talked about, and the only kind I'm talking about is Hennepin County has wasteful spending, and I'm giving more than 5 examples of wasteful spending that Hennepin County has, and this has led for Hennepin County to increase taxes for the last 5 years. Every single year, the Hennepin County commissioners have increased taxes, and because of wasteful spending the Hennepin County has.
Okay. That's excellent. I think that's okay. I don't think we have any other additional question because Sahra Odowa is also standing by. I think before we give you a chance to make your final statement, let me ask you a quick question. What do you do for fun to keep you going during this difficult time, bro? This
difficult time, I'm a golfer, but that doesn't mean I'm going to be golfing all the time. So Minnesota can only golf for 5 months. So and I came to golfing because I used to work at a golf course when I was going to school when I was going to college. So I ended up falling in love with golf. So I do golf, and I do exercise every morning. I'm a runner, obviously as a Kenyan, and by the way, talking about that, one of your favorites, Eliud Kipchoge, lost this morning, but hey, it's always the next year. So 2 things: golfing and running. Definitely exercising. Keeps me sane.
Oh, that's good. I think I want to try that as well. I haven't been keeping myself very healthy, but I'll probably join you in the golf course in the next few days.
Yeah.
So again, for our viewers, if, standing by right now, Sahra Odowa, also running for the state senate, she's standing by. So if you have any questions, please get ready for us. She'll be coming on momentarily, and following Sahra, we'll also be having on Nasibu Sarafa from the African Development Center here in Minneapolis. Will also be talking about the power of numbers. So stay tuned. But in the meantime, we want to have here Boni. There are many people watching you from the county, Hennepin County, across the state of Minnesota and across the country. And interestingly, we have a good number of people watching you from Kenya. What do you say as a closing statement?
As a closing statement is that one of the reasons that I'm running is because my mom used to tell me that when I was a young kid is that when somebody gives you something, give them back tenfold. And the U.S., the state of Minnesota gave me home and gave me a very good education. And this I'm taking this challenge of running as a commissioner to give back in public service. The former president JFK said, ask not what your country can give you, ask what you can give your country. And for me, I want to give back to state of Minnesota by being a public servant. And I want to encourage everybody who's in Hennepin County, especially in Bloomington, Richfield, Eden Prairie, please vote for me November 3rd. And you can vote right now on absentee. And vote me because I have fresh and bold ideas in the to bring in this 21st century.
Okay, thank you very much. I think that marks it. Thank you, Boni. It was an absolute pleasure talking to you. Obviously, I think our viewers are very excited really having you on the show. I think you made a very good case for the position you're running for, and we here at KDRTV and obviously the immigrant community is really very proud of you, and just know that we're with you all the way, and going forward, KDRTV is your friend. If you want to come back anytime, we'll be very happy to have you back on. So anytime.
Thank you so much for having me, and I look forward coming back here sometime, and we can chat and talk about other issues in our community.
Sounds good. Thank you very much. So again, for viewers, we've been talking to Boni Njenga, running for commissioner in Hennepin County here in the state of Minnesota. But at the same time, let's take a moment to thank our sponsors, Hennepin County. And if you look at, see down there, it's Hennepin. Thanks for sponsoring us. If you want to have a call regarding COVID-19, you're having problems or having a family member who's going through this problem, please feel free to call Hennepin County at 612-348-3000 if you need further assistance. Or you can go on their website at hennepin.usa/COVID-19 for any assistance. But also at the same time, we want you to subscribe. Please go to facebook.com on KDRTV. Subscribe and make your comment or questions, and more especially we're interested in having your feedback. As well, follow us on Twitter. We're there. And again, as you know, we're also streaming live on YouTube. Just go to YouTube and subscribe. All you need to do is just click that subscribe button, and that's it. You don't have to pay anything so that you will be our friend all through. So we're going to take a quick break for a commercial break, and we'll be right back after that commercial break with Sahra Odowa, who's also running for the state senate here in the state of Minnesota.
We know how stressful it can get to take care of the healthcare needs of your loved ones, especially when they live far away from you. Money transfer services have expensive fees. They cannot ensure that your money is spent on the intended healthcare needs. And there are many questionable pharmacies that sell low quality, unsafe, and even counterfeit medications. That is why we created Diaspora, a secure, quick, and cost-effective way to pay for the medications of your loved ones through our network of accredited and registered pharmacies. So here's how it works. Meet David. He lives far away from home. Unfortunately, his mother was recently diagnosed with diabetes, but she can't afford her new medication. So after funding his Diaspora account, David enrolls his mother as a beneficiary, and a unique PIN code is issued. Think of this as a digital voucher that David paid for in advance. David's mother presents the PIN code at one of our accredited and registered in-network pharmacies. The cost of her medication is deducted from David's account, and his mother can walk in and out of the pharmacy with the medication she needs. It's as easy as that. David can also assign his uncle who lives close to his mother as a caretaker to help her follow the new diabetes treatments. For extra security, David can also create one-time PIN codes and manually confirm and approve medication purchases too. It's easy to send more money home and hope they got spent on buying safe medication. But what if you can have control over how your money is spent, gain access to safe and quality medication, and purchase multiple medications for multiple family members who are in need? Your money goes a lot farther, and healthcare becomes a lot more inclusive. Diaspora was created by Diaspora members for Diaspora members that help provide greater access to safe, quality, and affordable medications for your loved ones back home. It's time for your loved ones to get the quality medication they need, and for you to get the peace of mind you deserve. Sign up today and register your loved ones for free at diaspocare.com. We know how stressful it can get to take care of the healthcare needs of your loved ones, especially when they live far away from you. Money transfer services have expensive fees. They cannot ensure that your money is spent on the intended healthcare needs. And there are many questionable pharmacies that sell low quality, unsafe, and even counterfeit medications. That is why we created Diaspora, a secure, quick, and cost-effective way to pay for the medications of your loved ones through our network of accredited and registered pharmacies. So here's how it works. Meet David. He lives far away from home. Unfortunately, his mother was recently diagnosed with diabetes, but she can't afford her new medication. So after funding his Diaspora account, David enrolls his mother as a beneficiary, and a unique PIN code is issued. Think of this as a digital voucher that David paid for in advance. David's mother presents the PIN code at one of our accredited and registered in-network pharmacies. The cost of her medication is deducted from David's account, and his mother can walk in and out of the pharmacy with the medication she needs. It's as easy as that. David can also assign his uncle who lives close to his mother as a caretaker to help her follow the new diabetes treatments. For extra security, David can also create one-time PIN codes and manually confirm and approve medication purchases too. It's easy to send more money home and hope they got spent on buying safe medication. But what if you can have control over how your money is spent, gain access to safe and quality medication, and purchase multiple medications for multiple family members who are in need? Your money goes a lot farther, and healthcare becomes a lot more inclusive. Diaspora Care was created by Diaspora members for Diaspora members that help provide greater access to safe, quality, and affordable medications for your loved ones back home. It's time for your loved ones to get the quality medication they need and for you to get the peace of mind you deserve. Sign up today and register your loved ones for free at diasporacare.com.
Yeah, a very warm welcome again. Welcome to KDRTV. As we said moments ago, we are back on, having had a very interesting conversation there with Boni Njenga, running for the Commissioner of Hennepin County. But now let's move on to another candidate. It's interesting that this year, unlike many years, we've had quite a number of immigrants really running for political offices here in the state of Minnesota, as well across the country. And I think this is really great news, not just for the candidates themselves and their families, but I think it's a big statement for the immigrant community here in the United States. I think the realization that this is not a foreign country, it's home, and we're here to make it home for us and our children. So that conversation with Boni Njenga is ended, and now we're happy to welcome to the show Sahra Odowa, who was running for the state senate here in the state of Minnesota from Shakopee, where we are today, by the way. Good to see you, Sahra. How are you?
I am doing well. Thank you, Dr. Okari. I want to thank everyone for having me join in on today's conversation. And I just want to thank everyone for the opportunity, the staff at KDRTV as well, and
so
to the viewers.
Good. So it's good to have you, Sahra. And just a friendly reminder that we are in Shakopee. So we are part of you, remember. So if you win, don't forget us, KDRTV. That's what we'll do first, just to be sure. So for our viewers, we just finished talking to your good friend, Boni Njenga. Interesting and a very candid conversation. Obviously, very proud of him, and also us very proud of you for what you're doing, not for you yourself and family, but I think it's a huge statement for the immigrant population, and particularly young people who are watching this really unfold. So for our viewers, do you mind very quickly introducing yourself?
Yes. Hello, everyone. My name is Sahra Odowa. I am the candidate running for State Senate, District 55, which represents Shakopee, Prior Lake, Jordan, and the surrounding townships. I am a mental and public health practitioner by profession. I am a graduate. I have a master's degree in public health and a bachelor's degree in natural and applied science with a biology and health illness concentration. I am a first-generation American. My parents are immigrants who've immigrated to the United States in the early 80s.
Okay. Oh, very nice. It's good to meet you, and I'm sure our viewers are very happy to meet you as well, because you're really carrying the torch for us. And that's good. So let's begin with first things first. And just like I did to our good friend Boni Njenga, we are talking about COVID-19 for a long time. And I think it's really transformed the way we do things individually, professionally, and that has also affected businesses and countries around the world. Let's have your perspective. What has been your experience with COVID-19? How are you handling it personally and professionally?
Yes, COVID-19 has really changed our perspective in how we see, our everyday lives, I guess, how we deal with our day-to-day routines. Personally, I am a public health practitioner, and so I've seen firsthand and have family members who have actually passed away due to COVID-19 and having complications, and really just personally, it's very tragic. We really need to take our precautions and just take the measures very seriously. We need to really, wear a face mask, follow the MDH and CDC guidelines on face masks wearing, just wearing a face mask, washing your hands, just staying 6 feet from one another. And so personally, it has affected me. It's impacted me. I've had family members, relatives who've passed away from COVID-19, and professionally, we see that many people are working from home. Many people, have really been laid off, don't have the necessities as we have seen prior to COVID-19, where people, would be able to go out and interact with one another. But not having that opportunity is very unfortunate. COVID-19 is real. Science is real. We shouldn't make it politicized. We really need to take in the precautions and really follow the guidelines and protect ourselves and protect one another, and just really keeping mindful that we weren't able to visit family members, and for the better, but also just really finding creative means to communicate. And so personally, it's affected me. Professionally, working as a mental health and a public health practitioner or in that field, it's very serious. We've seen increased cases go up daily. So we really need to be mindful. We really need to, follow the precautions, wear face masks, protect ourselves, and also be mindful of others around you.
Okay. Good to say. And by the way, KDRTV also shares your views, and obviously sorry for losing loved ones. It's a very tough time, and I think also take the opportunity to tell our viewers, please take care of yourselves. It's important. It's real. Let's really pay attention to what science is saying, and also noting the fact that if it hit the White House with our president now in a hospital, that really means it's very serious business. Obviously, KDRTV wishes the president and First Lady the best, and all others around the world who are going through this difficult time. So it's good to hear that, and particularly those ones within our community who are working at the front line, we wish them nothing but the very best. Please take care of yourselves. So let's switch focus here to the leadership. Sahra, the other day I was quote unquote stalking you on Facebook because I follow you. Something I liked about it. So you went to vote, and as you are walking on that picture, behind you was an absolutely wonderful woman, and you know who I'm talking about, your mom. And I read that statement was powerful, and I think it says a lot about who you are. I think your followers can as well go to Facebook and they can read that statement. What did your mom teach you about leadership and public service?
My mother, for the first and foremost, is my role model. She embodies leadership, a true leader. Just raising 8 children, including myself. I am number 4. I am the 4th child out of 8 children, and so her leadership has really instilled the values and the integrity that we should see everyone, with the respect, with, being able to immigrate to a country while having 2 children, and, just really not knowing the language, not really knowing the culture. Someone who has really worked her entire life to instill the values, the importance of, living in a respectful and peaceful environment, respecting people, just really keeping a positive mindset, and with her, just making sure that her children have, the basic education, the schooling, the, protecting us, having a roof over our heads, and just really being there for us through bad and through good times. She's a wonderful and amazing person, and, I couldn't have had a better mother. And I think all the mothers out, whether in the United States or in African countries, they are the backbone. They are the true leaders that we see. Mothers are the staple of households. And so without them, we wouldn't be here. And so I really am very fortunate to have her and her support and the support from family, just being there for me and, rooting me on. Yes, she is an amazing woman.
Okay, thank you. Well, again, thank her. We appreciate, and obviously our viewers appreciate her for raising, and obviously extend our appreciation to all mothers for the wonderful job they do. So based on that, and now you're moving away from private life to more public life, now let's focus more specifically on the position you're running for. For our viewers, what is the position you're running for, and why you run for that particular position?
Yes. So state senate, I'm running for a state senator position in District 55. And a state senator, typically state senator passes legislation that will impact the lives of many of the communities that they represent. And so the district that I'm running in represents many communities, we are a diverse and increasingly diverse communities in Shakopee and in Prior Lake in particular. But a state senator passes legislation. They work with the governor. The governor executes the decision to pass bills. And in doing so, the reason why I decided to run for various reasons, one in particular being that in Scott County, as a mental health practitioner, we are seeing an increased need for mental health services. We are, seeing students who are working or learning from home through distance learning that, may in part be trauma, not being able to be with their friends, to socially communicate with their friends and their fellow students. So the need for mental health services is very important, and in part why I decided to run, not only as a mental health practitioner, but also having relatives who have either a developmental disability or being on the autism spectrum. And so it's so important that we acknowledge and see the daily struggles and challenges that families are experiencing with caring for a loved one who has a mental health illness, developmental disability, or are having, coexisting chemical dependencies. And so that was why I decided to run, also being part of the local advisory council in Scott County for mental health. So we talk about the challenges, the barriers that individuals are facing in terms of how can they access and navigate to services that would be beneficial and accessible to their illness in particular.
Okay, good to know that. So thank you. And obviously, Scott County, Shakopee, where we are right now, the people watching and also people watching across the country who are saying, well, yeah, you are in Shakopee or in Scotty, but really, they really care about you as a representation of many others across the country. And obviously, there is competition. It's not just you. It's at a competitive position. So to the people, or especially of your county, what differentiates you from the competition? Or rather, what are your greatest strengths that people looking at you will say, yeah, obviously, clearly you're very eloquent, that's very nice, but what really differentiates you from your competition?
Yes, what differentiates me from the incumbent is that I have worked with various communities. I've worked with the immigrant population. I've worked with individuals who've had mental health illnesses. I've worked with, as part of a former board member for the Shakopee Diversity Alliance, I've created programs, to help improve the well-being and health of our community members and residents. And so I've worked actively with our communities. I am a great listener, and it's so important that we have a leader in office that will work actively, that will address the inequities and disparities of our communities, and especially of our communities of color, where we've seen a disproportionately high number of COVID-19 cases, of housing insecurities. And so part of being a leader and being a community member and stepping up to run was that I really and truly care about my community. I care about the needs of our community. I've worked in the community, and so I have that experience, personal and professional experience, to lead and to also create for better representation of Scott County and District 55.
Okay, well said. You're talking about the representation, and particularly for the quote-unquote minority groups, which is really the focus of our TV. We what we're really calling a positive diaspora narrative. There are a lot of immigrants across the country who have gone through very difficult times, but we got to a point where, yeah, we acknowledge the challenges, but at the same time, we also need to spin this in a positive way. So there are really quite a number of people in that area. And by the way, for our viewers, Nasibu Sarafa is standing by to talk about the power of numbers. I hope, Sahra, you stand by as well to listen to him. He has very good information to share with our immigrant community. So let's switch focus specifically to the immigrant community, because they're really interested in what you're doing, and hope going forward, obviously, you need their support. What are some of the biggest challenges that you think they're facing or we are facing, and how will you address those issues?
Yes. So for one, housing would be a big issue that a lot of our community members are currently facing. There is a housing crisis. Many people are facing eviction. And so we really need to ensure that we have secure housing, the need to have housing that is affordable and accessible in the district. And our district is thriving with development at this time, and we need homes that could accommodate larger families, that could accommodate those with physical disabilities. So housing and the price, of course, that's the obvious reason why we have a housing crisis. There is an increased housing rental, in Scott County and in Shakopee and Prior Lake in particular. We are seeing housing costs rise. This is not, something that we need at this time. We need housing that could accommodate, all families, and that is income-based, and so housing would be a number one issue, along with, healthcare. Healthcare, people are uninsured at this time. People are without work, so they don't have and rely on their employer's health insurance. And so the need to access healthcare is important, that we have our community and people who are able to access healthcare that is affordable, also reducing our drug prescription costs. That is another issue that we're seeing. The high costs, and putting a demand and putting pressure on pharmaceutical companies to lower drugs or medicines for people to take. People who have underlying health conditions such as diabetes, high blood pressure, high cholesterol. We're seeing that there is a high number of our communities, especially the communities of color, our immigrant populations, who have underlying health conditions. There's COVID-19. So COVID-19 exacerbates these health inequities, the health disparities that we're currently facing, topping it off with housing costs. Also we are seeing many children who are learning online, through distance learning. And the issue that we have is broadband access. Not a lot of parents and families have access to internet. Not only that, we're seeing there is a language barrier. Many of the parents are unable to navigate or help their children, have a successful learning experience and journey. And so these are the top three issues that we're currently seeing, in immigrant populations, but also statewide, with access to broadband. It's so important that we have, internet access to go to work or to be able to, work from home, to be able to teach our kids, to have an educational experience that is successful and that is positive.
Oh, Sahra, you already got a vote before I finished even the interview.
Oh, I'm so amazed and I'm so humbled. Thank you so much. Thank you.
Okay, for our viewers, okay, if you have questions and comments for Sahra, please feel free to go to Facebook and put those comments and questions. We'll give a few minutes to answer some of your questions. But in the meantime, let's stick to a discussion here. We're talking about politics. It's a political process. As you know, the reason as to why people go through the election process is because they want to have leaders who are not just going to be elected and be there for their families, but who are going to affect policy. You did talk about policy, and Boni talked about policy as well. And you're talking about policy, you're talking about different aspects. For example, the education. What kind of educational policies will affect the immigrant population? What about policing, for example? There's a discussion around defunding or completely doing away with the police force. You're talking about immigration matters. You're talking about religion, and all these factors are part of what you're going to do if elected, decision-making or policy-making in the state senate. And people are looking for a leader who's going to make decisions that will affect them in a most positive way. What will inform your decision-making process?
Yes, what will inform my decision-making process is just sitting down, having these conversations with our communities. That's very important, because we have so many concerns. so many concerns that will have leaders, create decisions that will ultimately affect the livelihoods of our communities. And so having conversations is very crucial. Being a great listener, as I said, having that empathy, having the understanding, having, the lived experiences, and being a child of an immigrant or of immigrants is a firsthand experience for myself growing up, and so these issues are, I guess, a cycle, and we need to break the cycle and have leaders really work with their communities and listen to their issues, listen to the concerns, so that we can take those concerns to the Capitol and advocate on behalf of every community member. And so that's very important.
Okay, that's good. It's good to hear. It's politics. People say, they're politicians. They talk nice, sweet, and as soon as they're elected, they're gone. They get into a new club, and that's all about it, So maybe you're going to be unique. If elected, and obviously we're wishing you the very best, you elected, how will you continue being engaged with the immigrant and particularly minority communities? Because we really need a voice.
Yes. And that positive voice is, if elected, I will be that positive voice for being a representative who really cares and who is an active member in the community, someone that will have their voices to the Capitol, someone who will advocate for healthcare reform, for immigration rights, for improved education and prioritizing early childhood education through higher education, someone who will, advocate on the housing need and the crisis that we're currently facing, someone who has the public health experiences, and in COVID-19, an advocate that will protect the health and safety of our communities. So these are all so important to me, having the professional and personal experiences and volunteering in our communities. It's so important that we have someone who's willing to listen and play an important role in the decisions that we are currently making. And currently, we don't have legislation, and it took 4 special sessions to pass legislation that was bipartisan, on a bipartisan governance or level, and the House has passed really important bills that were not passed in the Senate, in part due to the Senate Republicans. And so we need to flip the Senate, and it will only take 2 seats. However, we really need to flip the District 55 in order to have, meaningful impacts that would positively change the insight and positively have conversations in the community about racial injustice. Communities that are welcoming to our immigrant population and to our immigrants, and communities of color, including the Native American community, which is high or increased in an increased number of immigrants or Native Americans in the community in Scott County. And so we need to have community conversations, as Boni mentioned earlier. We need to have leaders who will sit down on the table and to say, hey, I'm here for you. This is what we will, this is the conversation that we'll have. If you have any questions or, concerns, someone who's reliable, who will, take calls, who will answer emails, who is there for their constituents. And so, yes, that is very important.
Sahra, one thing that I've been very impressed with, right? Listening to you, there's something that has come out very clear, and I'm sure our viewers will share the same sentiment. I've hardly heard you say I. What I've heard you say all through is we, our, we, our, we, our. I think that speaks volume for people listening to this. You're not looking for somebody who is really going to run for self-interest, but she's really talking about we, which is really very important for our community and more specifically those in the Scott County. So let's move forward and talk about the big picture here. Why should folks vote during this election? Because pretty much it's been described as the most consequential election of our lifetime. Why should they?
Yes, it's so important that we have all voices represented during these important elections of our lifetime. We often see that we have leaders in office that make these promises but don't keep their promises. And so we need leaders who will work alongside with their constituents, alongside with their communities, to address the issues that we're currently facing, you know. And it's so important because your voice matters, your voice counts. Your voice ultimately will determine who will be representative of your district and the communities that they plan to serve. And so I would entirely empower or encourage every single person living throughout the state of Minnesota, and especially living in Scott County, Senate District 55, to vote for someone who will work alongside with you. Not someone who will make these promises, not someone who will give you false hopes, someone who will ultimately work to address the inequities of our health, education, our environment, someone who will address these issues, someone who will work with you in order to create these positive changes. So I highly encourage everyone to vote this election. You can vote. There's 3 ways to vote. There is early in person, which began on September 18th. You can go into your local city hall to to vote early in person, and to also request an absentee ballot. You can, once you've requested that absentee ballot, the ballot in itself, you could either mail it into and send it to a secure ballot box, or you can take your ballot and physically hand it to a poll worker who will then secure the ballot in that way. Also, you can vote, and wait until the general elections, which will be held on November 3rd. However, there's no excuse. There's no excuse to not vote. People's voices count, and this is an important election. This election matters, and this election, is really dependent on your voice. And I really and highly encourage everyone to vote.
Okay, good. Before we let you make your final statement or closing statement, Sahra, there are people watching you, and we always ask this question, not just you, but almost every lady who come here. I think it's rare to see, particularly with the immigrant community, ladies stepping up and running for public offices. I mean, it's not just about District 55. It's a huge statement for women across the country, and more especially young girls. And me, myself, as a dad to young daughters, I'm looking at you and saying, wow, my daughters can be there or be beyond that. So what do you say, you as an immigrant Muslim woman running for public office, what do you say to especially young girls watching you today, or who will be watching these videos later on?
Yes, it's so important, to have goals, to have aspirations, and if I can do it, you can do it. We need to empower one another, we need to support one another, we need to be there for one another in order to establish and encourage people to run for office. It's not easy. I can't say it's easy. It's very frustrating. It's empowering. It's exciting. It's all in one. And so I won't say that this is going to be an easy run. If you decide to run for a political office, patience is key. Know that you're not alone. Know that you will be well supported, and that we are here for you. I am here for you. And being a woman of color, being someone who has personally been targeted because being a Muslim, having so many factors in place to be targeted for the obvious reasons, is not the America we want to build. We want to build a unified, we want to build an inclusive and equitable society so that everyone can thrive, so that everyone has a place and a voice for positive changes. And I say to people, I'm someone that was born here in this country. I love this country, but I also hold another identity, and that identity I hold very close. And it comes with balancing both cultures, both languages, and someone that has had those experiences, who is running for office, shows you that we all have a voice. Shows you that we're all here for one another. Shows that we can bring these changes for the betterment for all Minnesotans. And in doing so, we need to work together. We need to support one another. And, that is my advice to any young woman who wants to run for office. You can do it. Don't let anyone tell you you can't, because you can. And you are powerful. So I thank everyone, and I thank you, Dr. Okari, for giving me this opportunity to speak to the viewers at KDRTV today. So thank you.
So that's quite encouraging to hear that. Quite encouraging to hear that. I hope my daughters watch this and make sure that they are inspired. Hopefully, you can mentor them so that they can run for political office in the future. I'll be so excited. That would be the best gift they can give me, if any. So, and I appreciate the fact that you are talking about. We honestly appreciate you so much for doing that. And again, as I said to our viewers, Nasibu Sarafa is standing by to talk about the power of numbers. And I think that's very powerful. When you're talking about a state like the state of Minnesota, which is, I think, one of the most immigrant-friendly states in the nation, and now by all indications showing that the minorities are likely to be the majority within the next decade, I think it's important for all of us to participate in the political process so that you and others can make policies that obviously will make us grow and own the state and obviously be part of the larger conversation in this country. And I think that's the conversation I'll let Nasibu Sarafa talk about as he comes on in a short while. But in the meantime, I think the best I can do for you, Sahra, there are many people watching you in Scott County, obviously across the state of Minnesota. And then there are also those ones actually watching from beyond the country, those watching in Africa and Europe. So what is your closing statement?
Yes, my closing statement is that I ask for your vote on November 3rd. You can actually vote early. I am, someone that is willing to work with everyone, work on bringing positive outcomes to our communities at large, and someone that will run to prevent, the inequalities that we're currently seeing right now. A divided nation, a divided community. We need to have leaders who will step up and willing to work with everyone. And I ask for your vote. I ask for, if you're able to do so, to volunteer, to go on to my website at www.sahraformn.com, and that is spelled SAHRAFORMN.com. Read more about my platform if you're interested, if you have any questions. I'm here for you to answer any questions that you may have. My email is sahraformn@gmail.com, and you could volunteer, you could donate. I'm asking for your vote as early as possible. You can mail in your ballot, or you could vote on November 3rd for Sarah.
Okay. Thank you, Sahra. It's been an honor talking to you, quite frankly. It's been very delightful talking to you, and I'm sure our viewers will enjoy this, and those who will be watching this after will definitely appreciate you. So, and again, don't forget that KDRTV is your friend. We're with you, and we'll be with you all through and in the campaign. As soon as you win, and obviously you feel free to come back and use this as a platform to making our story as positive as possible. So be comfortable coming back again. It's been an honor talking to you. And I think someone did ask a question there, what position you're running for. You're running for the State Senate from District 55. We wish you nothing but the very best. We'll talk to you later. And I think for our viewers, we've been talking to, again, Sahra Odowa, who is running for the State Senate of Scott County here in the state of Minnesota. And now, again, before we wind up and bring on our colleague and friend, Sarafa Nasibu, who will be talking about the power of numbers from the African Development Center. We also want to appreciate our sponsors, Hennepin County. If you have questions regarding COVID-19, please feel free to reach out to them at that number there, 612-348-3000, or on their website at hennepin.us/19. And don't forget to subscribe to us. We are live on Facebook. Do so if you could. Go to YouTube as well. Subscribe and follow us on Twitter for all updates regarding a positive diaspora narrative. So we'll take a quick break, commercial break, and then we'll come back on with Nasibu Sarafa from the African Development Center. We'll be talking about the power of numbers.
We know how stressful it can get to take care of the healthcare needs of your loved ones, especially when they live far away from you. Money transfer services have expensive fees. They cannot ensure that your money is spent on the intended healthcare needs. And there are many questionable pharmacies that sell low quality, unsafe, and even counterfeit medications. That is why we created Diaspora, a secure, quick, and cost-effective way to pay for the medications of your loved ones through our network of accredited and registered pharmacies. So here's how it works. Meet David. He lives far away from home. Unfortunately, his mother was recently diagnosed with diabetes, but she can't afford her new medication. So after funding his Diaspora account, David enrolls his mother as a beneficiary, and a unique PIN code is issued. Think of this as a digital voucher that David paid for in advance. David's mother presents the PIN code at one of our accredited and registered in-network pharmacies. The cost of her medication is deducted from David's account, and his mother can walk in and out of the pharmacy with the medication she needs. It's as easy as that. David can also assign his uncle who lives close to his mother as a caretaker to help her follow the new diabetes treatments. For extra security, David can also create one-time PIN codes and manually confirm and approve medication purchases too. It's easy to send more money home and hope they got spent on buying safe medication. But what if you can have control over how your money is spent, gain access to safe and quality medication, and purchase multiple medications for multiple family members who are in need? Your money goes a lot farther, and healthcare becomes a lot more inclusive. Diaspora was created by diaspora members for diaspora members that help provide greater access to safe, quality, and affordable medications for your loved ones back home. It's time for your loved ones to get the quality medication they need, and for you to get the peace of mind you deserve. Sign up today and register your loved ones for free at diaspocare.com.
Again, welcome again to KDRTV Live, wherever you might be tuning on. Welcome on KDRTV Live. As we said again moments ago, we are honored again to continue our conversation around driving a positive diaspora narrative. And we've had a chance to talk to two absolutely brilliant African immigrants who are running for state political offices here in the state of Minnesota. Started off with Boni Njenga, who's running for commissioner in Hennepin County, and also did just talk to moments ago Sahra, who's also running for the state Senate from Scott County here in the state of Minnesota. That's fascinating, and I think quite a promise for the African immigrants here in the United States, really indicating that this is home, and we're here to be the story not for ourselves, but for our children and generations to come. I think there's a huge population of immigrants across the country, and more so here in the state of Minnesota, where I think now it's been described as one of the most friendly, immigrant-friendly state in the nation, with thousands and thousands, I think now going to millions of immigrants coming from the continent of Africa and elsewhere around the world to this state. And really, we're going to get into the discussion around what does it really mean by having these huge numbers. We have thousands of people from great nations across Africa, whether it's Nigeria, South Africa, Kenya, Somalia, Ethiopia, Somalia, all those countries across Africa were represented here. And also there are many others who have great interest in the continent of Africa. But perhaps the big question that we haven't asked ourselves that we should now be asking and start this conversation around, how do we make use of these huge numbers? To help us do this, we'll be talking to our good friend and one of the, I think, one of the most successful African immigrants here in the state of Minnesota, our brother and Tanzania's own Nasibu Sarafa, who's joining us here live now. Hi, my brother Nasibu, how are you?
Hello, good morning, Dr. Okari. I'm pretty good, thank you. How are you today?
I'm doing good. It's very good to see you and very good to have you on the show today.
It is a pleasure to be on the show. First of all, I would like to thank KDRTV for invitation and holding this very important conversation. Secondly, I would like to really thank you for your leadership and honored to be with you this morning and hosting this conversation. And last but not least, to all the viewers of KDRTV.
Okay, very good, Nasibu. For those of us who have known you for as long as we have, 2 decades plus, we know you as one of the most dynamic African leaders here. You've done exceptionally well in business. You've really done great work helping the community, and I think African Development Center in Minneapolis is a good story, a great inspirational story for us and everybody, quite frankly. I think you're affecting this population positively in the social and economic aspects. Yes, we know you. I know you very good. For our viewers, do you mind very quickly introducing yourself?
Thank you so much, Dr. Okari. Yes, my name is Nasibu Shereva, born and raised in Tanzania. Professionally, I'm a number guy with a BA in accounting and finance, and MBA with accounting emphasis, and a bunch of other certifications of accounting. Came to the US in 2001 with really just one intention to change the world. I worked for a corporate world before. I did a little bit of community work when I worked for corporate. So when I came to the US, my real intention was, I think I was done with the corporate world and really wanted to figure out some ways to change the world. Here I am today. We do what we do, and feel so happy when I put smiles into our communities.
Okay, great work, and that reminds me that we came to the U.S. around the same time, 2001. I can't believe it's been 19 years ago. I came in as a young guy. Now I'm getting great. It's interesting. It's interesting how times change. Good. So, Sarifa, just like I did to the previous panelist, obviously we're talking about a positive diaspora narrative. But before we get into the niche details of our discussion today around the African Development Center, let's talk about COVID-19. I think it's affected, and quite frankly, it's transformed the way we do things. Individually, personally, I've been working from home for almost the rest of the beginning of the year, and most likely to sometime next year. And I think it's affected businesses, families, and even the world community now is responding differently. And interestingly, and unfortunately, even our president right now in a hospital because of COVID-19. And that's a big statement as to how serious this virus is. But let's focus on you, yourself, as a person, as a family, and professionally, how you're handling it.
No, thank you so very much, Dr. Okari. First of all, would like to send my prayers to the President, First Lady, and all who have who got affected by this really crazy disease. Personally, it's been a challenge, frankly speaking. I have two people in the front lines. I have two RNs in the family. My family, my wife and daughter. So we have really been taking one day at a time. They have been taking care of COVID infected patients. They have been tested on a weekly basis so far. So far, so good. Again, as I said, we have really been taking one day at a time. Professionally, with me, it has really been different compared to a bunch of other people. I did not have a luxury of actually most of the time to work from home. I've actually been going to work. As we may all know that, the pandemic started sometimes with all these new details that are coming out, but it really affected the state in really big numbers, sometimes in March. So we've had our offices at the African Development Center closed ever since due to some of the great decisions that were made by the governor. However, because of the COVID, then later followed by the civil unrest due to killing of George Floyd, I have actually been going to work ever since. So we have been managing, administering some of federal and state relief programs. Right away after the first governor executive order, the governor and the legislators were able to put forth some funding, of which we had to do some zero interest loans between $2,500 to $35,000 to help some of these small businesses to survive, pay some of their bills. We were able to do that within very few weeks. That tells you right away that we had to stay in the office. Later on, we did a few of our federal programs. So as I'm speaking to you right now, we're still doing some other state local programs, like one from Minnesota did, about $10,000 to small businesses. Plus, we're helping really micro businesses between 3,000 to 5,000 within the Hennepin County.
Okay. So, Sarif, nice, thank you for that good intro, and I think sharing your views that your family members are the front line. We wishing them the best, obviously, and our viewers. Again, we keep echoing this same call. COVID-19 is serious. Please take care of yourself. That's important. We need you. We need all of you. I think we need to do as best as we can, follow the guidelines, so that we really be around here to do the very best. I think for most of us do know who the African Development Center is, especially for those ones who are running small businesses here in the state of Minnesota. I'll encourage you, as we continue the conversation with Nasibu, please feel free to post some of your questions or comments, and Nasibu might have time to answer some of the questions as we go through the conversation. And I think African Development, quite frankly, has done some of the best, I think, brilliant work that you guys have done over the last a decade plus that I've got to know you. But for our viewers who probably do not know what African development is, and more especially small businesses and those ones hoping to have small business, Nasibu, do you mind talking very quickly or give a quick background who African Development Center is and what you guys do?
Thanks much, Dr. Okari. So the African Development Center is a not-profit community developer and commercial lender dedicated to economic empowerment and success of African migrants throughout the state. So we are a statewide organization with 3 satellite offices, talking about transferable or generational wealth. We own the building that we are in here in the Twin Cities. We bought another building in Wilma where we house one of our satellite offices, and we have 2 more satellite offices, one in Rochester, and we just opened one in St. Cloud. Our mission is to grow business, build wealth, and increase investment in the African communities in Minnesota. So ADC, in a nutshell, ADC was launched because existing economic development organizations lacked the resources needed to address the financial, cultural, and language barriers that hinder African immigrants from achieving self-sufficiency. Our aim is to facilitate economic integration as well as the civic and social participation that the market of a vibrant and healthy community. Cultural competence is the key to ADC high level of success in meeting our objective. So the African Development Center is a CDFI. What is a CDFI? It's a financial institutions that going through the certification through the Treasury Department that provides credit and financial services to underserved markets and populations. ADC is also SBA lender. Within the SBA lender, we pay attention to. We are part of a couple programs. So we do SBA micro loans, of which allows us to do working capital loans up to $50,000, and we've been blessed to get some funding for us to do these loans within this particular program. We are also SBA Community Advantage lender. So this is part of the SBA 7A program for people who are familiar with this program. But this program allows ADC to do loans up to $250,000. So with that $50,000 of working capital, ADC can easily do a loan to any particular immigrant-owned business up to actually $300,000. We continue to be creative and figure out some other ways that we can actually bring more capital that is really very needed to our community.
So, Nasib, thank you for that quick background. I think, like I said with the previous guests, we're talking about African communities here in the U.S., and I know we'll get into the numbers momentarily. We've been talking about the negative stories. There's a lot of challenges really affecting the community. But honestly, and by the way, we have some people watching from Africa, it's not only negative stories. We also have very positive stories. And people are watching you right now and who will be watching the show days after today, and they might say, oh, what did he say? Did he say Africa development that sponsors businesses. So if you want to speak directly to especially the African immigrants, what are some of the specific programs that, products that you have? And somebody running a small business or hoping to run a small business will say, oh, wow, I'm going to go to ADC.
Great question, Dr. Okari. So ADC, we are a very laser focused when it comes to our programs. We've decided to continue to do that. Even though we do a bunch of other things like advocacy work and a few other things, we're really laser focused into three key programs that we deliver, which is one, financial literacy education, two, home ownership training, and three, business development. So with the financial literacy education, as we all know that as immigrants arrive in Minnesota, they bring a high level of capacity and drive. We all know that, but have few assets and often, more often than not, very limited experience with the Western financial institutions. So to help, ADCs offers customized training on issues such as building a credit score, personal debt management, basic banking, household budgeting, and savings for college or a home, customized to the specific needs of the recipient. These sessions are usually, especially with the, that has to do with personal financials are sensitive in nature. So because of that, we do private sessions. And then we go down to the training as of, what is a checking account? How can you open checking account? How can you actually maintain and establish your credit? So we go really that low to make sure that people really don't understand the financial system of this country, get to know what they need to do to get ready. And within the home ownership training, so ADC, first-time home buyer workshop and counseling program prepares and support African immigrants and other low to moderate income in a minority household using the home stretch curriculum. This is part of Minnesota home ownership curriculum that people are required to do if they need to get down payment assistance. So this program prepares prospective homeowners with the resources and knowledge about home buying process, requirement, and best practice that help ensure long-term home ownership success, of which, because of going through these programs, a lot of African immigrants who actually bought homes during the economic crisis in 2008, 2009, we didn't see a lot of them actually going under in terms of their home ownership. And the lastly but not least is business development. So we all know entrepreneurship is an attractive option for many immigrants. We all know that statistics have shown either immigration overall in the country or immigration here in the state of Minnesota, which we go back way back to the Danish, to the Norwegians, to the Jewish, that through entrepreneurship, immigrants have been able to do really, really well. But access to conventional loans is difficult. So ADC offers development workshops, one-on-one technical assistance, and a small business financing that is tailored to the circumstances of African immigrants, as well as alternative financing options. So through the training program, prospective entrepreneurs receive information on how to start businesses, with information covering writing a business plan, obtaining insurance, and addressing best way to market businesses. Okay. One-on-one technical assistance is providing to those attended the class, as well as existing businesses owners. Last but not least, this individualized direct support helps owners with obtaining permits, licenses, and other requirements to operate small businesses in this country. So technically, we really go into a lot of nitty-gritty to make sure that people understand how to run business in this country.
So I'm glad as you responded, I like the fact that you talked about cultural sensitivity. And I think some people, especially the immigrants, sometimes get nervous that if they apply for loans, particularly with the mainstream financial institutions, that might be problematic, including the fact that your last name might also be an issue. And I'm happy that, in fact, your good friend Jean Galgalo from Little Africa will be on the show again next week also to talk about the intersection of culture and development. I think that's good to see these positive stories come on. But for people watching you, and obviously will be watching later, what do they need to do to get funding from ADC? And if they do get funding, is there any other additional support that you provide them?
Yes, Dr. Okari, we do. So the first thing that I would advise, because we've created a very good and simple process and procedures that will actually help everybody to undergo so that they can work with us and get funded. Which starts, if you've not been in business for over 1 year, we would like you to go through our business plan class. Statistically, out of over $15 million that we've deployed, it has shown that people who have actually gone through this business plan class have been very successful. Now, usually, out of people who attend the business plan class, only 20% will say that we're ready to actually go through financing program right away. For us, that's success, because what we're really instructing into this class is more into the experience that we have had in the over 600 businesses that we've helped, loans that we've put together. So we're really talking about the real-time experience that we need these people to make sure they're actually ready to get into business. So when people get back and say, no, we don't think we're ready, we will come back later for actually financing stage. For us, that is really a success story. And once you are done with the class, the only thing that I usually tell our community is that we get a lot of people who come to us who say they needed money yesterday. If you work with us, we will make sure that you get funded, because the only difference is we may tell you that, we think you need 1 or 2 extra days before we actually fund your business. But we are very, very flexible in terms of risk level management, in terms of how we analyze deals. And with all due respect, Dr. Okari, what I tell our community, and I really still believe that is true, if we actually get to the final answer and say we don't think we're going to be able to finance your business now, that means you've decided not to work closely with us. With all due respect, I don't believe that there's anybody else that's going to be able to actually touch your business in the country. So that's how deep we have been analyzing this particular project. And the last question quickly here. Yes, we continue to offer, we do a lot of pre-technical assistance, pre-loan technical assistance, and we do heavily post-loan technical assistance. So you will continue to get our support, not only when you actually have loan with us, but also after you have actually paid off and when you actually continue to grow your business.
Okay. Oh, good. Thank you for those insights. Again, for those who are running small businesses, feel free to post your questions on Facebook. We'll have a minute or so for Nasib to respond to those questions. If you intend to run business as well, please have that question for him in a moment. So let's move further. You and I have had this private conversation, and I think one of the key highlights from our private conversations is what you call the power of numbers. That we are talking about here, and I like the way you said in the intro, you came here to change the world. And I'm sure almost every immigrant who came to this nation came here to achieve the quote-unquote American dream. Of course, that is questionable depending on what you define as success. But let's get into the numbers itself, and obviously you're a numbers guy. We now have a huge population of immigrants across the nation, and more specifically here in the state of Minnesota. From your end, Nasibu, how do we make use of these numbers? And I think some people, unfortunately, and I repeat that, unfortunately, we tend to look ourselves as people based on our ethnic groups. So, for example, if I'm Kenyan, look at myself at the tribal level, which is okay, but I think that's a narrow way of looking at things. Or if, say, I'm Kenyan, I tend to look at myself as Kenyan, and still that's fairly narrow in the face of really the potential that we have here. But if you look at anybody who's born in the continent of Africa and who's come here willingly to achieve the American dream, if we put those numbers together, I think we can achieve big things. From your end, how do we make use of those numbers? And if any, are there numbers to support that power?
Yes, Dr. Okari. What a great question. So let me put it in a very layman term here first. When we talk about power of numbers here. So if you look into the number of African immigrants that are in the state of Minnesota right now, we have enough number if we are coordinated better, if we are organized better, we should be able to influence any decision that is being always made for us. Now, if you look into if some of your viewers have followed Council Member Abdi Wassame, right before he was elected, we were at the 10th year where we have to do the redistricting. So when we were doing that, one of the things that he did really well, he actually made sure that he was at the table when they're actually doing that. And then he pushed for that policy to be done right. And when you do that, they were able to put one segment of our community within the area that actually he was running for that council member seat. You see? So when people were voting, we all know how much he has won. You know, so we have really enough large number of immigrants. If you're talking about, these are undisputed numbers. If you're talking about over 150,000 immigrants, now we're talking to the first generation here. We have the second generation. That's going to be a conversation for another day. So with that, of which I'm really very excited. I've been watching Sahra here in your previous session, of which we need more of her. Again, if we coordinate better, if we organize better, we should have way more elected officials moving forward than what has been done before. But again, the key here is coordinate, organize better, and that should do it for us. Then people will not continue making decisions on our behalf.
Oh, you know, so Nasibu, as we go further, you know, as you're talking, you know, the other day I was looking at the numbers from the state, and this is really real for our viewers, especially here in the state of Minnesota. I was looking at what they're calling or defining as minorities. They're saying children who are below age of 10 and who belong to whatever they're calling the minorities are more than the Caucasians. So that means in the next decade, in 10 years' time, we're going to have more minorities into the workforce, and therefore the minority will be driving the socio-economic and indeed the political agenda of the state. So the question then becomes, if we don't really put ourselves together, or if we remain as divided as we are, it's likely that we won't be able to achieve big things, and actually we won't even be able to make the state compete across the nation. From your end, I have my views as to why we're having these problems, but from your end, what do you think are the three biggest challenges for us? And when I talk about us, and you know that Sahra was talking about we, our. What are the three greatest challenges that are facing us from achieving our common goal?
Great question. So, you know, so I really like the previous session that Sahra was talking about we, and I think we should learn from that, and we should continue to do that. I think one of the biggest challenges, which you've mentioned, that we're doing a lot of you know, I when we come here into the U.S. There is before you go into you know, a lot more details here. There was a model that was done in Portland, Oregon, which is a coalition of community of colors. Why am I actually quoting this model? So far, this could be, if not the only model, is one of very few models that was able to actually put all people of color together, and then they started advancing interest of the whole perspective of their own perspective communities together. Now, here it is. Let me give you a little bit of facts here, because I visited, was honored and blessed to actually visit the leaders of the coalition of community of colors in Portland, Oregon, and I had spent about 3 to 4 days with them. So it took them 13 years to put 7 different communities together. I'm not saying that it's going to take us 13 years. I'm saying that if we look into that model, I think we can do a little bit faster and we can do it better. But another example that I'd like to give it to you, within that model within the 7 communities. People can actually Google that, Coalition of Community of Colors in Portland, Oregon. The African House, which is led by an African immigrant brother. It took him 3 years to put everybody at the table. It took him 2 years to put one country, people from one country, at the same table to actually having a conversation that we're having right now. So it is not very easy. However, if you look into all the challenges that we are all going through are pretty much similar. If you look into who is actually making decisions for us, they are the same people who are making decisions for us. If you're not careful, we're going to continue to be divided. So we have a few leaders who actually prefer us to be divided than us to be at the same table and make these decisions for our own selves. You see, so there are models that have worked, and looking into the leaders that we have in these states, looking into some of the things that we've done, I really think and feel that we are far ahead on so many ends that we've already done in these states, and we're not going to be a better really community unless we all sit down together and figure out some ways so that we can work as one community. As the governor said, one Minnesota, we need to be one community. I'll give you one simple example, which I'm not really propagating that we all should do that, but I've seen in the previous election, in the previous primary, whereby we have a couple African immigrants running against each other, against maybe incumbent, you see. So those, I think, are some of the things once we are coordinated better, organized better. We want everybody to participate in that civic engagement. However, if you're coordinated better, then we should have some of the seats that we have actually lost.
Okay, good. You mentioned several times about table, and previously you did talk to me. This is interesting phrase. If you are not on the table, then you're on the menu. What does this phrase really mean? I think put this really in a layman's language, and I was thinking about me being on the table or me being on the menu, and I was thinking about McDonald's, and I looked at that menu. I'm looking at salad. I'm looking at the burger, and I'm saying, no, I'm not the burger. I'm not the salad. What? Maybe try to explain. I know you're a soft-spoken and an eloquent guy. Can you explain that to our viewers? What does that really mean? If you're not on the table, then you're on the menu. What does that really mean to our collective being?
Great question, Dr. Okari. So, again, I've seen this personally into a lot of tables that I'm setting that actually I don't see ourselves. But again, in a very layman term, if you are not represented at the decision-making table, if you are not represented, you are sitting at a very vulnerable position. You get left out. And the worst case scenario yet is you are on the menu. So, again, in a very layman term, so our interest, if we want our interest to be part of the either, leadership consideration, any type of leadership that we're talking about here, as they make plans and as they make decisions, we have to be at the table. But if we are not at the table, that means they will sit down and make all the decisions, whether it's going to be investment to our kids, whether it's going to be investment, access to capital. So they're going to make decisions based on a lot of assumptions because we are not there, especially when we talk about cultural competence. We are not there to make these decisions to ourselves. So others will make these decisions on our behalf. And I've seen a lot of that happening even here in the state of Minnesota. Now, let me make one more point here. You may have a seat as well, which I've seen a few companies, a few organizations with the conversations of, being inclusive that has been talked about, over and over again, which I encourage because that is very helpful. But you may be able to sit at the table, but at the end of the day, you actually don't have a voice. You see, so we need to be very careful with that. because you're there, but your voice are not heard and not considered. So again, as I said, I've seen many times, and one of the very good examples is a few years ago when actually we had a special session, and there was a report that came out from the Susan Boer that says black folks, disposable income went down by, I believe, about 14%. So all of a sudden, everybody, started figuring out what should we do to make sure that we curb that. That included investment that came from the state. And then there was that special session, I believe it was $30 million or a little over $30 million that was actually passed in that special session. And guess what? I knew that, by the way, and then I had to push big time to make sure that our community is considered. So I keep going back over and over again and ask our community, I would like anybody to tell me how much actually out of that $30 million to $35 million investment our community was actually invested in. You see, so that's exactly what I'm talking about. If you're not at the table, then other people will make decision as to, you know what, your community does not need that enough. I mean, they don't need anything, or this is all what they need. So we need to be at the table to make these decisions on ourselves, of which, again, as I said, I'm so excited with having a lot of our own people running for elections.
So Nasib, as you talk about that, sometimes those of us who've been around here, I can't tell you how much sometimes I walk into the classrooms and I hardly see students from the African continent. Once some do, I think that I see that sense of happiness. Here he is a brother, and I think they want to be there and go be beyond that. There's something that I've seen in our community, quite frankly, and I don't know how the best way to go forward. Maybe give us your take on this. I've seen that we're so much divided into different ethnic groups. Like I said, for example, my country, Kenya, different tribes, and we focus heavily on tribes. You see you're making the case for Tanzania. I have a lot of friends from Uganda, friends of Cameroon, Ethiopian, Somalians. I have all these groups from across Africa. Whenever I have a conversation with them, I honestly don't see the difference. The difference is pretty much the same. It's not really a difference. Going forward, how do we really move beyond this tribal, ethnic, and national differences so that we can have a common front?
Dr. Okari, what a great question. I have experienced and see exactly the same thing. I think one of the things that I hope is not happening is us giving up. I think we should do a lot of convening. I think we should do a lot of education. I think we should take what had happened in our past as actually a good experience on what we want to do and actually create our own narrative on what we want to do in the future. Because what I have often seen is that people are giving up and say, somebody has tried and it didn't work. And who do you think you are that you want to do? And what exactly you want to do different so that it's going to work? I think we should do a lot of convening, a lot of discussion, and we should continue and hopefully create our own narrative. Again, as I said, take past as an experience and actually move forward. As far as I'm concerned, I'm cautiously optimistic. I really think that this is doable, but we need to do more convening of all of us and figure out what will be the best way forward. Again, I don't want to create an agenda. I think we should, again, as I said, we should create our own narrative. So we should create our own agenda as to what we need to do moving forward. Let me give one short, quick example here. There was a time where I was talking to our counterparts, African Americans, about this type of issue. What should we do so that we can work together better? And one of the points that was made in that convening was that we don't want to go back into many years ago, whereby we had a lot of social interaction. So we need now to mean business and reduce those social interaction and start doing something that are actually having tangible results. I had a meeting that I convened a few years ago with our own brothers and sisters, leaders of African immigrants. That was only one meeting. Now to finalize here, when we had that meeting, I said a couple of things. One, I don't want to create an agenda. We should create a community agenda. And two, what I said is there's so many things that we don't do. And when we are looking into the past experience, we may not want to look into our counterpart who said for over 200 years, they were doing a lot of social interaction. Now they need to do some things that are tangible. Maybe we should start where they started and then change the way we can do moving forward by making sure that we do a lot of convening, we support each other, we support our businesses, we support our communities, because at the end of the day, our challenges are pretty much similar to our counter brothers and sisters.
Okay, sounds good, and I think that's part of what we're doing here, KDRTV. Our commitment is to make sure that we create a forum where all immigrants, particularly from the continent of Africa, can come here and exchange these kind of ideas. And I think in the past weeks we've been doing this, going around the African communities and having African community leaders to come here and have a conversation around the issues that are affecting us. And I'm glad that the business community is also coming on board. You're coming on board, and my good friend and our good friend Njenga will be joining us here next week to talk about the same again. So I think that's important if we could really continue that conversation. We'll get some. I think that's the most important thing. So let's move quickly before we end the conversation here and talk about what's going on in the country, the campaigns and the elections. I think most people have described it as the most consequential election of our lifetime. In your view, what do you think is very consequential, and why should people vote?
Great question, Dr. Okari. So we all know that that we all need to vote, and why do we need to vote, apart from this being the most consequential election probably in my American lifetime? So, the power to decide the quality of life that we all want, for our own selves, the power to decide the quality of life for our kids in the future. It's all in the ballot. That's why we should actually vote. You see, there is if there's any issue that we all support, so this could be, public transportation. This could be, we need more investment to, schools for our children. This could be actually, again, going to go back to public transportation to our African immigrants communities in various communities. This could be, the fact that when we come to this country, we take any job that we want. If you want to push for a minimum wage to be increased, if we need any sort of actually meaningful investment. One of the ways, if not the most important way for us to actually do impact that, is for us to go to the polling booths. It's for us to actually vote. Because if we don't vote, we go back to if you're not at the table, you're on the menu, because we are letting other people elect other people who don't have our interest to actually, at the end of the day, come back and actually make decisions on our behalf. You see, so it is really, really very important for us to make sure that we vote. And I really let me underscore this point. Not voting is actually giving up for our voice. So if you're not voting, regardless of the situation that you have, regardless of the discussion that you have, regardless of how you feel about these elections and the candidates, let us make sure that we vote, because if you don't, you are actually giving up to a vote. Again, all the decisions when it comes to the, let's say, tax dollars that we actually all make a lot, which that could be a conversation for another day, as to how much immigrants contributes in terms of the tax dollars to the state and how much exactly the immigrants are actually getting back in terms of the investment. Again, that's a conversation for another day, but the election actually help us to make that decision in terms of how we're going to spend the tax dollars that we actually all contribute into. So this is crucial, and I urge everybody to really go and vote.
Oh, thank you. Nasib, I think what Muala is asking simply is how can they get connected with the African Development Center?
Great question. So one, if you go to www.adcminnesota.org, adcminnesota.org, you will find our information there. You'll find, my name, my contacts, and all ADC staff. please shoot us an email, call us. You're going to find all of our phone calls. We would love to talk to the viewers and everybody who would like to sit down and have a conversation.
Okay, great. Thank you. I think that should be it. Nasib, I think it's been a great talking to you, but I think I'm going to give you one last minute. There are people watching you, I think, from the business community, the immigrant community here in the state of Minnesota, and others watching from across the country. What is your closing statement?
Dr. Okari, it has been a pleasure. Thank you so very much for, again, convening these great discussions. One of the things that I would like to highlight here as my closing statement is that it's been a long ride for our community. We have been here for about 15, 20 years now. One of the things that we don't do enough is talk about success stories of our community. We all know that we've created a culture. We've created a new ethnic, better community. We've developed transnational identities. We all know that we've introduced food and familiar to the American public. We've then turned around that old ethnic cuisines to mainstream style of cooking. We should make sure that we continue to talk more about our success stories. And our community is resilient. And one last thing is that, as Dr. Okari said in one of the sessions, this community is here to stay. We are really blessed and love to call these states of Minnesota home. And we need to come together, coordinate better, and push to advance our common interest of our community together. Thank you so very much, Dr. Okari.
Oh, thank you, Nasib. I think that marks the end of our conversation. It's been very fascinating having you on. Thank you very much. And I think our viewers, especially those ones in the business community, small businesses, will be very fascinated to get to know more about ADC, African Business or Development Center. You guys are doing a fantastic job. And I think that's great. And I think thank you so very much. And thank you to your family. Thank you for the wonderful job you've been doing for not just the business community, but I think for the immigrant community. I think KDRTV salutes you. And I think for you, you're welcome anytime to advance the agenda for not ADC, but also for the immigrant community. Thank you again so much, Nasibu.
It's a pleasure, brother.
Good. And thank you for our viewers. Thank you. We've been talking to Nasibu Sahra from the African Development Center in Minneapolis, and I think they're doing a great job. I think there are some of the small businesses that are really focused on developing a very positive diaspora narrative. There are many good stories across the country of people who originated from Africa and that are doing great things. We'll continue going around communities to talk about some of these individuals so that it can be an inspiration for all of us as we drive that positive diaspora narrative. Before we conclude our session today, I want to thank our sponsors, Hennepin County, for sponsoring this show. Again, if you have any questions regarding the COVID-19, please feel free to call them at the number shown here on the screen, 612-348-3000. And if you're on the website at hennepin.us/COVID-19, feel free to go there and post any questions you have that is in regards to COVID-19. At the same time, before we sign off, we encourage you to go to our website, follow us there on Facebook, make your comments. We really welcome your positive feedback. As well, you can go to Twitter and also follow us on the same note. Don't forget also to go to YouTube and subscribe. As I said earlier, you don't have to pay anything. All you need to do is just click that subscribe button and you're good to go. You'll get our daily or weekly updates. Up next again, we'll be here. Up next on Thursday, we'll be talking about addiction and gambling. We'll be having Dr. Richard Oni and Billy Banjako. They'll be talking about addiction and gambling within the immigrant community. That'll be on Thursday at 7 Central Time. Don't forget again to join us next week at 11 Central Time when we bring on Little Africa with my good friend Jean Galgalo. They'll be talking about the culture and its intersection with socio-economic development. So that'll be next week again on Sunday at 11. And again, we'll be also having community leaders talk about the need for community leadership and partnerships before that. So again, next week. But for now, thank you so much for being with us again. Enjoy your Sunday and we'll see you soon. Coming up, I'm reminded to say community engagement, a further conversation after this commercial break.